notice that you or one of your loved ones is having difficulty during social conversations, it may be time to get a hearing test. Earlier in the year, we brought you this story from the audiology specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, who explained that there is nothing to be afraid of when looking into hearing aids.
One thing that we do not like to see is when someone starts to withdraw from social activities. And so when we see a patient who is withdrawing from playing cards, going to lunch with the ladies, then it's definitely time to take a step and look into hearing aids.
We always tell people, just stop and look at your surroundings. How often am I having to ask people to repeat themselves, or how often am I not hearing it so I don't answer? Those are kind of the signs that maybe you need to start getting a hearing test so we can see where you're at.
At one time it was very difficult for people to get adjusted to hearing aids because of the size. They were larger. When you would put the hearing aid in your ear, it would make you feel like you were talking in a barrel, or you would hear the sound of your own voice, and that was a very large complaint. In addition, people did not like hearing aids because they amplified background noise and a lot of different noises in the environment. Hearing aids today are a lot different. They're very comfortable, they're very natural sounding, and they're a lot smaller than they used to be.
There's a variety of styles of hearing aids. There's ones that go behind the ear that have an ear mold that's made to fit your ear. There's ones that just have a little tube in your ear. Those are called open fit hearing aids. By far, that's the most popular right now. There's ones that go in your ear and ones that go completely in your ear so they're invisible. You have a trial period of 30 days, so you take them home. You might come back in, we'll make some adjustments for you, try them again. If they're still not working, we'll move on to something else. We might try 2 or 3 different things before we figure out what works for you.
Success with my patients would be having a smile on a face, having someone say, I wish I would have done this years ago, I can't believe how well I'm hearing, or just simply putting a hearing aid in and seeing for the first time their significant other, their child, their spouse say, you're hearing me and you were not hearing me an hour ago.
For more information on hearing aids and the audiology services available at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Missing Out story link on our homepage at yourhometownhealth.com.